She has to get recording and then get in position.
Oh, you get position.
She's recording now.
Oh, okay, she's recording.
They had so I could hold a few cards.
What is lupus? Lupus is a disease that most people don't even know that they have. My name is Lexi McIntosh. I've had lupus for 5 years. I'm going to talk a little bit more about it. I will first explain the causes of lupus, which is the person's white blood cells are considered overactive. The blood cells attack the regular blood cells within the body. It pretty much thinks that it's having an infection when the body isn't, so it's attacking itself. The body fights itself at all times. In other words, your immune system fights off everyday infections and also wears down the tissue of your body, and which pretty much your body needs it to survive, so your body's attacking itself all the time. In lupus, something goes wrong with the immune system, which is a part of the body that fights off the virus, bacteria, and germs, which are called foreign invaders, like the flu. Normally, the immune system produces proteins called antibodies, which is protected from these invaders, which is actually a quote from lupus.org. A person with lupus that has body issues can slowly destroy itself from the inside out. Your body has extensive white blood cells, but not enough red blood cells, which wears away at the body's tissue and it starts destroying itself. This is a problem when your body is shutting itself down and your body thinks it's having an infection, but it is not. For a personal experience, when I was 22 years old, I became very lethargic and sick. I could not stand, I could not do anything without getting sick. I ended up going to the hospital and finding out that I had lupus. Systemic lupus, where my body and my blood cells were diminishing itself because they thought I had a foreign invader in my body, but I didn't, and I ended up becoming anemic. The second aspect of lupus that I want to talk to you about is the symptoms of lupus. So pretty much your body will ache, anything with joints will hurt, it breaks down tissues and autobodies that take care of inflammation, and it causes damages to those parts of people's bodies. It also takes over major organs like your heart, your brain, your lungs, your liver, your reproductive organs. Anywhere that it can get to you is in your body already. The person will be more prone to bruising and sensitive to the sun, which is also caused by the medications that we have to take at all times. The person with signs of lupus might become sad, angry, depressed because they're not understanding the traumatic experiences the body has been going through, and they are trying to figure it out as this disease progresses within the body. According to UpToDate, most patients recover within 1 year with helping from family, friends, physicians, or other professionals. Other patients may incorporate the depression into their personal life and develop psychosymptomatic complications, which can include insomnia, fatigue, anorexia. Patients also may develop psychotic features with increasing despair, loss of hope, or even suicidal tendencies. It is also known that if you do meditation, mindfulness, things like that tend to help people with lupus because they are easing some of the anxiety within the body, and that is a major thing that can cause within the body is flare-ups, and within those flare-ups can cause swelling, pain, and tenderness to the muscles. If you do meditation, it helps with the inflammation, it helps with the dealing with the mental strain put on somebody's body. If you do those therapeutic things, just also talking to somebody about things like a one-on-one type conversation is a major help as well. There are also antidepressants that doctors can prescribe lupus patients, but as of right now, most of the medicine that helps lupus patients and then the medicine that helps lupus patients with their depression usually don't coincide very well together. So lupus patients are still trying to figure out how to get those prescription drugs to properly work for them when it comes to that. Another main medications that people will take are Plaquenil, which is a drug that they will take for life. It can affect your eyes after 10 years of taking it, so you are supposed to get a routine 1-year checkup every year for your eyes. Also, steroids are a quick fix, is what they call it. It helps get rid of the pain and tenderness and stiffness quickly, but it doesn't necessarily always last. A quote from Mayo Clinic: while there's no cure for lupus, current treatments focus on improving quality of life, control symptoms, and minimize flare-ups. Thank you for taking the time to listen to my speech about lupus. With the knowledge that you were able to distinguish with the aspects of lupus, the causes, symptoms, and treatments, roughly 1.5 million people have a form of lupus today. There's no cure for lupus, and there are ways to manage it. With this information I'm providing you with today, it can make you more aware of the causes, symptoms, and treatments of lupus. And for an ending, I would like to talk about a quote from the Columbia Library. It says, "By educating and empowering people to become actively engaged in their treatment and encourage participation in the lupus community through advocacy and research is our plan."